New at 5:30, state leaders announced a new temporary health regulation in response to a continued hospital staffing shortage and emergency department overcrowding throughout Rhode Island.
The regulation will allow EMS personnel to work under the supervision of an on-site healthcare provider in hospitals or licensed healthcare facilities.
Other measures, along with an important message, were announced in a gathering of hospital and public health leaders today. 12 News reporter Alexandra Leslie joins us now live in studio with those details. Alex?
Well, Kim, seeking care in the right place and taking simple preventative health measures. There are two things you can do to help free up the space in emergency departments. Today, doctors painted a picture of just how bad they say that overcrowding is. For weeks, Rhode Island doctors have been working inside emergency departments at or beyond capacity.
Today, it looks like an 82-year-old grandfather forced to wait in the emergency department for 2 days while having a heart attack because there is not a bed in the cardiology wing.
RSV, flu, COVID, all still making an impact, but doctors say there is also an ongoing behavioral health crisis.
It looks like a patient with depression that's so severe he's actively suicidal, forced to wait in the emergency department for 3 days for a psychiatric bed.
Hasbro Children's Hospital has been as high as 125% capacity or more in recent weeks, largely due to a surge in RSV cases.
We have had a little bit of a breather in the past few days, and that the RSV may have started to tick down a little bit. But I don't think any of us are sort of claiming victory at this point.
Doctors say a major way you can help is by reaching out to primary care providers or urgent care before making the ER your first stop.
We do not want you to hesitate to bring your children to us when they are sick and injured, because that is what we are here for. But we also recognize that we have limitations on our resources that we've never seen before.
The state is intervening to help in a few ways. The Department of Health is expediting the licensing process so new healthcare workers can join the workforce quickly. Plus, an emergency regulation will allow EMS staff to work inside hospitals too.
Every little bit helps, and it's not any one thing. So is it going to solve the problem? Of course not, but it's every little bit will help.
The state is also asking primary care doctors to help do what they can to keep emergency rooms below capacity, including making more same-day sick appointments, offering expanded or non-traditional office hours, and using telemedicine. Live in studio, Alexandra Leslie, 12 News.